Okay, so I'm in a nursing station. The first thing I'm going to do is compare my physician's order to my MAR. And in doing it, I'm checking the patient's name, Jasmine Green, the type of medication, gentamicin, the dose of the medication, 80 milligrams, the time of the medication, every 8 hours, and the route of the medication, Ivpb. I'm going to assess for allergies. The patient has no known allergies. And then I'm going to get my medication, which we have gentamicin. And while checking my piggyback medication, I'm looking at the color of it, make sure it's clear, nothing floating around. Checking the expiration date, January 2021, so it's good to use. And I compared that with my MAR. And go to my book. So yeah, gentamicin. So in the book, we're making sure that it's a safe dose. The book states 3 milligrams per kilogram of body weight every 24 hours, equally divided into 3 doses, which would be 1 milligram per kilogram every 8 hours. It also states up to 5 milligrams per kilogram every 24 hours may be given if indicated. So it is a safe dose. Dilution. It's available pre-mixed in several concentrations. Vials equal 10 or 40 milligrams per milliliter. Further dilute each single dose in 50 to 200 milliliters of IV normal saline or D5W. Compatibility. So we have gentamicin, and what we have hanging is normal saline. It is compatible. The rate of administration, the book states each single dose properly diluted over 30 to 60 minutes, up to 2 hours in pediatric patients. Indications and uses, we use gentamicin to treat infections. Precautions, use extreme caution in patients with end-stage renal disease, potentially nephrotoxic, ototoxic, and neurotoxic. Risk of neurotoxicity, so they have auditory and vestibular ototoxicity is increased in patients with pre-existing renal damage or abnormal renal function with prolonged use. Monitor, we need to periodically monitor peak and trough concentrations. Therapeutic level is between 4 and 8. Avoid trough levels above 2 and prolonged peak levels above 12. Adjust the doses indicated. Side effects: anorexia, burning, dizziness, fever, headache, hypertension, hypotension, itching, lethargy, muscle twitching, and nausea. So that's all for the book. And then from this point, I will work my drug problem. So the drug problem has already worked, so we are going to be giving 13 drops per minute. And so from this point, I got my medication, my MAR, and I will go ahead and fill out my label right now. After I prepare my medication, fill out my label. Got gentamicin, 80 milligrams, the date 9/23/2020, the time 8 a.m., expiration date of it January 2021. The patient name, Jasmine Green, room number 253, start time 8 o'clock, start date 9/23/2020, and the flow rate will be 13 drops per minute. So from there, I'm ready to see, well, I got my equipment too. And I got my equipment. So I need to go ahead and get my equipment together. I'm gonna wash my hands. I'm not telling you. Okay. I'm going to maintain sterility. So from there, I got my MAR and my medication. medication and equipment, I'm ready to go into the patient's room. So I'm in the patient's room. I identify myself. My name is Akia Coleman. I'll be your student nurse. I use 2 patient identifiers. The patient states their name and their date of birth. I assess for allergies. Ask the patient, do you have any known allergies? The patient states no. I'm going to explain the procedure. The physician has ordered you to get gentamicin as an Ivpb bag to treat an infection. And then I'm going to perform hand hygiene. From that point, I'm going to look at the existing IV line, assess for redness, edema, signs of infiltration. Ask the patient, is this site causing you any pain? The patient states no. Then I'm going to go and lower the primary infusion bag to make sure that it's patent. And when I do this, I get good blood return, so that lets me know that this line is patent. And from that point, I'm gonna go ahead and lower my primary infusion. So from that point, I'm going to clean, scrub the hub for 30 seconds, and now we're going to dry for 30 seconds. And we're going to be going into the port that's closer to the bag. So vigorously clean it for 30 seconds. Then we let it dry for 30 seconds. And at that point, I'm ready to connect. So it's connected, everything is open on my lines. But due to technical difficulties with the mannequin arm, I think that it's backed up. So I will not be able to count the drops from my secondary, my piggyback infusion. I will have to do it via the primary infusion, but I know in real life, we regulate it with the primary infusion, and we will count these drops. But like I said, due to complications, I'll have to look at those, the primary drops. So I'm gonna undo these. And so the calculation is 13 drops per minute. So I'm gonna go. It's gonna be too fast. I'm gonna start over. Okay, go. Okay, I'm finna get ready to start. Now. How's my time? Is it kind of close to the end?
20 seconds.
Okay, I think I'm gonna count one more time. Start. Okay. So after camera drops, I get reconnected. You know, even though I wouldn't do this in the real city, I reconnected. And I dispose of my secondary, my piggyback, as in you go dispose of it. I would dispose of it, and then I would raise on primary bed. Then I would assess the patient, observe them, make sure they're fine. You know, regulate the flow rate back to what the doctor had previously ordered. And this concludes my piggyback.